Welcome to the first episode of our clinical education series, DM Myth, True or False? In this series, we'll tackle some of the biggest questions about dental monitoring using real data and scientific literature to separate fact from fiction. Today's myth is the following. Patients prefer seeing their doctor over remote monitoring. Is this statement true or false? Let's explore the data. A survey done by Accenture in 2019 that targeted more than 2,000 patients showed that younger consumers, notably the millennials and Gen Z, were more likely to be dissatisfied with traditional healthcare. You can see here that the younger the patient is, the bigger their dissatisfaction grows, notably when it comes to the effectiveness of the treatment, convenience, and transparency. These younger patients expressed that they were more likely to choose a medical provider that offers digital capabilities such as online booking, easy communication, and remote monitoring. On top of that, the COVID-19 pandemic significantly accelerated this already existing trend. An article from McKinsey published in 2021 showed that telehealth popularity increased 38 times from the pre-COVID baseline, strongly suggesting that this is becoming the new norm. You can see here, even after the initial spike, the levels remain stable over the next year. Now, let's narrow it down to orthodontics. A cross-sectional survey study conducted in 2021 by the AAO research program in partnership with the Harvard Orthodontic Alumni Association showed that 25% of the respondents started using a remote monitoring platform during COVID-19. But what was really interesting is that nearly all of the orthodontists who started using a remote monitoring platform said that they plan to continue using it for the foreseeable future. But the real question here is, what do patients think about this approach? A study published by Dalessandri et al. In 2021 found that 97.5% of patients judged their experience with dental monitoring positively. In that same study, 81.25% of the respondents said that they were interested in leveraging DM to reduce visits. Interestingly, that finding was consistent with another studies. A study published in the JWFO found that more patients prefer to use DM instead of coming in for a regular expansion check visit. Another study by Hansa et al. Found that most patients found DM easy to use and 88% would prefer as few office visits as possible, even the ones who live close to the office. And lastly, we did our own global study that included 2,248 patients from 12 countries, and we found that most patients were highly satisfied with their DM experience. 89% of patients said it was very beneficial to be able to communicate with their orthodontist via the DM app, 76% said they felt more engaged in the treatment because of DM, and 86% felt more reassured by the process. When asked what their favorite thing about DM was, the three most mentioned benefits were more convenience due to fewer visits, better communication, and reassurance. So, do your patients really love you so much that they prefer taking time out of their busy schedules to come see you every 6 or 8 weeks? Maybe, but probably not. Thanks for watching and see you next week for another episode.